We are now entering into count 5, the last count of this historic indictment, the count of public health inequities. And we're going to start with a pre-recorded video hearing from Dr. MaryLouise Patterson, who is a board member of the Physicians for a National Health Program. And in the tradition of carrying on the tradition, MaryLouise Patterson is the daughter of the famed William Patterson, who helped to spearhead the original petition, We Charge Genocide, 70 years ago. So we will now hear the video of MaryLouise Patterson, and she will be, her examination will be directed by Corey Purnell, student attorney with Howard University, Thurgood Marshall Civil Rights Center. Thank you.
Hello, everyone. My name is Corey Purnell. I am a student attorney at Howard University School of Law Movement Lawyering Clinic. I'm going to be introducing you all to Dr. MaryLouise Patterson. Dr. Patterson's father, William Patterson, was one of the initiators of the original We Charge Genocide petition. Dr. Patterson is going to be discussing several issues today. First, she's going to introduce herself and discuss how she is connected to this case. Secondly, Dr. Patterson is going to discuss how racism and healthcare tie into genocide. Lastly, Dr. Patterson will discuss what can we do about healthcare and racism today.
Good evening, everyone. I'm here tonight representing my father, William L. Patterson, who dedicated his entire life to the valiant struggle against racism. 70 years ago, he co-authored and courageously advanced a petition that charged the U.S. government with genocide. For what other label would accurately describe the near annihilation, then betrayal, banishment, erasure of the remaining First Nation peoples, followed by the stealing of their children, and or the 400+ years of terror and indescribable heinous brutality of the offspring of the millions of violently kidnapped Africans, and or the racism and discrimination of Latinx Americans who fled here because of impossible living conditions in their home countries, conditions created by the US Capitol and enforced by the US military. There is no other label for all of those crimes other than genocide. So happy 70th anniversary to We Charge Genocide. And thank you, Dad, Paul Robeson, and the many other courageous comrades who by signing that petition put their lives and the well-being of their families on the line. Incidentally, they also highlighted how genocide practiced at home was a central ingredient of US foreign imperial policy. I want to thank everyone on the organizing committee, especially Matt Mayer and the Spirit of Mandela Coalition, who have grabbed the charge of genocide baton and are carrying it forward. I've been asked to talk to you tonight about racism in healthcare. I know all of you recall Dr. Martin Luther King's statement about healthcare in this country. He said, and I quote, "Of all of the forms of inequality, injustice in healthcare is the most inhumane." But I know I'm preaching to the choir. All of you know only too well that there is racism in healthcare, that glaring healthcare and health inequities and disparities exist. For how could they not? All of our institutions, healthcare institutions included, our entire culture, this country's founding laws and practices are super saturated with racism and have been since the arrival of Europeans. Racism and white supremacy are essential requirements in our daily diet. Like calcium is for our bones and vitamin A is for our vision. They're as American as apple pie. Everyone who grows up in this country is negatively impacted by this poison. And like poison, when doled out daily, isn't necessarily immediately lethal. Rather, it steadily and stealthily rots us from the inside. I don't think I have to tell you that there is not one healthcare index that African Americans, First Nation, or Latinx people don't suffer from worse. But we can't leave poor whites out of this picture. Yes, poor white people also have poorer healthcare indices and outcomes than their richer relatives, as they only have to be dispensed slightly better, or what appears to be slightly better healthcare than what is dispensed to African Americans. Healthcare is not only racialized, but monetized as well. But then you know that too. So we can't leave the white middle class out of this. They can't pay their astronomical hospital or prescription bills either. In fact, the alarming increase in bankruptcies from exorbitant healthcare bills is highest among the white middle class. Institutional and structural racism is reflected in discriminatory healthcare policies, in the underfunding of preventive care, in the fewer and poorer quality healthcare facilities that are chronically understaffed and under-resourced, in the rationing of care, in racist curricula in medical, nursing, and social work schools, in fewer doctors and nurses of color, in the denial of or limited access to the latest treatments or best medications, in the inaccessibility of long-term care, in the leaving out of government coverage for glasses, hearing aids, dental care, in the implicit biases, prejudices, lack of respect, and common courtesies heaped upon and endured by patients of color. All of these, along with the detrimental impact of the chronic exposure to elevated stress hormone levels, plus, are culpable in the existence and persistence of the racial disparities, the greater morbidity and mortality from acute and chronic illnesses, and the negative healthcare outcomes so well documented in the scientific and popular media. Yes, Latinx, American, African American, First Nation, Indian Americans, and Pacific Islanders, infant mortality is more than thrice that of whites, and our maternal mortality is more than twice that of whites. Our longevity is at least 7 years less, not to mention the poorer quality of that longevity. What about the undisclosed or forced sterilizations of thousands of Black women in the South, Indigenous women on reservations, and of women in Puerto Rico, which is incidentally predominantly Catholic? Or the profiteering off of Henrietta Lacks's cancer cells, or the Tuskegee syphilis experiment. Then there were the partial lobotomies of incarcerated men, mostly men of color, African American men, in maximum security prisons up until the 1980s. Now, we not only have mass incarcerations of teens and adults of color in this country, but we have the recent expose of the decades-old dark ages system of mass incarceration, including solitary confinement of Black children as young as 8 in Rutherford County, Tennessee, on charges that didn't even exist, to name just a few racialized medical and mental health crimes. Of all the socioeconomic determinants of health, segregated housing, overrun with vermin and mold, overcrowded and deteriorating, is the worst, as it creates unhealthy and unsafe neighborhoods. In our communities, garbage is infrequently collected, streets infrequently cleaned. Few, if any, parks or playgrounds exist, but somehow guns and drugs are plentiful. Permanent physical and brain damage from lead is delivered right out of our kitchen and bathroom water taps. The air we breathe is highly polluted thanks to the greater number of industrial plants, waste treatment centers, and highways that surround our neighborhoods, which cause middle of the night mad dashes to the emergency room for asthma attacks and other lung and heart diseases. And it marks our premature deaths. I can't emphasize enough the physical and emotional psychological toll from the inescapable daily exposure to all that, plus all other manner of overt and insidious racist expressions, actions, policies, from racist police brutality to healthy food deserts, to dilapidated, underfunded, and under-resourced schools, to generations of unemployment and or employment in the most dangerous and dirty jobs, to homelessness, poverty, and hunger, while images of a pretty, clean, safe, fun life and beautifully decorated home are flaunted every night on our TV. For many of us, that life is only a few bus or subway stops away, but we can't have it. Doesn't all of that reflect the partial destruction or annihilation of a people? I contend it does. Or just ask Serena Williams if income and fame is protective for African Americans or for those discriminated against based on color or national origin. Do you remember the dangerous postpartum course she had? With all her money, celebrity, and white father of her newborn, she almost died in the immediate postpartum period. Or ask the 19-year-old bereaved son of Dr. Susan Moore, a 52-year-old African-American woman and an internal medicine doctor who died of inadequate and delayed proper medical treatment of COVID complications she was experiencing. She bravely shared with us what was happening to her on a self-made video from her hospital bed, where she pleaded for help, recognizing that she was being mistreated. She was dumped out of that hospital after speaking out and died 2 weeks later after being admitted into another one. What gets less attention, but is equally horrific and important to know, is what's happening in mental health. Did you know that a third of African American patients needing mental health services never get them? And those who do usually wind up getting them in the emergency room, so their care is interrupted and episodic. When exhibiting the exact same symptoms as whites, African Americans are more likely to be diagnosed with psychoses, like schizophrenia, rather than with mood disorders, like bipolar disease. In other words, they are more likely to be misdiagnosed, which leads to receiving the wrong medication. We're more likely to be deemed more severely ill, therefore hospitalized more, and prescribed higher doses of antipsychotic drugs that have greater negative side effects. African Americans with mental illness are incarcerated at much higher numbers than whites. There are far too many Americans who didn't know or didn't want to know or just weren't paying attention because it wasn't that important to them that racism existed in healthcare. Unfortunately, it took the COVID-19 pandemic to make that undeniably clear, that racism and the profit motive in our healthcare system or non-system produced the frightening and criminal death and overwhelming illness toll we witnessed, and which some of you may have suffered over the past year and a half. Over 700,000 dead, over 100,000 children left without one or both parents. I repeat, over 100,000 children have been left without one or both parents, and most of those children are children of color. The nightly TV news, our daily newspapers, and the radio stations all broadcasted COVID incessantly. It dominated our social media, as did the fake news and lies. We saw the inadequate and incompetent federal response, with the president at the time deliberately pitting states against state in policy implementation, acquisition of PPE, gloves, and other medical equipment, the bodies piling up, the impromptu morgues, the mass confusion and fear, the chaotic and discriminatory distribution and delivery of the vaccines, causing an alarmingly high impact on communities of color, unmasked the woefully pathetic condition of our racist and for-profit healthcare system. Some of us thought the demand for a national healthcare system, or at least Medicare for all, would become easier. In cities across the country, weren't we banging pots every night in a show of support for our beleaguered healthcare workers? Wasn't COVID making it painfully clear that our self-proclaimed world's greatest democracy had not only denied us a truly functional national public health care system capable of responding to a pandemic, but instead gave us an unfathomable number of dead, overrun and depleted hospitals and a totally exhausted and demoralized healthcare personnel? Surely out of this nightmare would come a deafening public outcry for the creation of a free national healthcare system like all the other industrialized countries have, and many non-industrialized countries as well. So I started this talk saying we all know that healthcare disparities based on race, income exist in the United States, and that wasn't going to be news for any of you. In fact, I suspect many of you may have read Medical Apartheid by Harriet Washington, in which she describes the inhumane experimental surgeries and medical treatments, tortures really, as they were usually done without any anesthesia, on unwitting and unwilling Black people from the colonial period up to the books publishing in 2006 and republishing in 2008. Well, many of those experiments ended in the implementation of new surgical and/or gynecological treatments in use today. Well, what can we do about racism in healthcare? The answers are beyond this talk, but one step those who live in New York State can take is to fight for the New York Healthcare Act pending in the New York State Legislature, which would provide free universal healthcare for all those residing in New York State. And if you don't live in New York State, then join the national fight for national health care or Medicare for all, the achievement of which would level a serious blow to racism in healthcare as we know it. Thank you very much.
Ancestral spirits are surely part of this tribunal. I'm sorry, I'm just overcome. The daughter of William Patterson.